I'm here with Dr. Ken Schiffman, who is a board-certified orthopedic surgeon with Hinsdale Orthopaedics and handles upper extremities. He's on staff at Hinsdale Hospital and at Good Samaritan Hospital in Downers Grove. Dr. Schiffman, I know you're known for your excellent work in shoulder injuries and particularly rotator cuff surgery, and we're discussing rotator cuff surgeries today. What is a torn rotator cuff and what causes it?
Well, rotator cuff problems are very common. The rotator cuff, and this is a model depicting a shoulder, this would be a right shoulder, so that the collarbone is here, the shoulder joint is here. The rotator cuff muscles become tendons, and the tendons attach to the top of the humerus. So here are the tendons attaching here. Rotator cuff tendon problems, as I said, are common. Many times it's just inflammation or tendonitis, but rotator cuff tendon tears also occur fairly frequently. Now, sometimes the rotator cuff tear is a result of trauma, that is a fall off a ladder, for example. But most of the rotator cuff tears actually are attritional, meaning that they occur as a result of wear and tear over a long period of time.
How is it diagnosed?
Well, rotator cuff tears are typically picked up on an MRI.
Can you tell when someone comes in to see you that they might have a torn rotator cuff?
Those patients that have a large rotator cuff where most of the rotator cuff is detached, that diagnosis will be apparent on examination. Those patients have a difficult time lifting their arm away from their side.
Mm-hmm. So you can tell when they come in, but the best diagnostic test is an MRI.
Yes.
How is a torn rotator cuff treated? How do you treat it?
Well, and again, a torn rotator cuff, and what we're talking about when we use that term is we're really assuming that a portion of the tendon is detached from the bone, and that's very important to understand because partial rotator cuff tears are common. And that means that the tendon is not truly detached from the bone. Those patients do not necessarily need surgery. However, if any portion of the rotator cuff is truly detached from the bone, it cannot heal without being reattached, which means surgery.
Tell us about surgery.
The surgery for a rotator cuff repair typically these days is done as an outpatient procedure. Patients come in and go home the same day. That surgery can be done either with a general anesthetic, that is the patient is put to sleep, or with a regional anesthetic where the nerves around the shoulder are numbed, if you will, and the patient is sedated. Most, if not all, of that surgery is done as an arthroscopic procedure these days, so we're working through small incisions, although in some cases a small incision is needed to truly get the tendon reattached to the bone.
And the recuperation usually takes?
Recuperation is long, and that's one of the points that I stress to my patients if we're embarking upon that course of treatment. Recovery is long, so that physical therapy may be required for anywhere from 3 to 6 months, and return to activities, that is strenuous activities, either work or sports activities, excuse me, at a usual level can also be anywhere from 3 to 6 months after surgery.
But the first thing that anyone should do if they have a shoulder injury like this is see a good orthopedic surgeon like you.
Yes, and again, that's so that we can catch these things early, so that either surgery isn't needed or a lesser procedure is required.
Okay, well, thank you so much, Dr. Schiffman. Dr. Schiffman is a shoulder, elbow, and hand surgeon at Hinsdale Orthopaedics. He practices out of Hinsdale Hospital and Good Samaritan Hospital in Downers Grove. And you can book an appointment with him through his website or by calling 630-455-7135. Thanks so much.
Thanks, Lisa.